So in general, once we've established what dose of medication that we are going to be starting our patient on, we'll help you recognize with the syringe what the appropriate increment and the appropriate amount to be drawn up is. And when we're giving the insulin injections, we're going to find a place on their body that we can elevate up their skin a little bit to be able to help guide where the needle is going to be going. And in general, I give the insulin injections between the shoulder blades, which is basically at the bottom of that neck, and in that area where we can grab a little bit of skin to be able to elevate that skin up. And I'm going to basically inject either underneath my index finger or between my index and my middle finger. So some tattoo are a little bit more sensitive about getting those insulin injections. And again, it's a little bit of trial and error finding areas that tend to be less sensitive versus others. But what I'll do is when we're drawing this up, I'll basically just be kind of petting them, trying to rub on them and whatnot, so they actually think that they're just being loved on. Again, then we'll elevate that up. I'll kind of give that kind of a few squeezes, and sometimes we'll actually agitate the skin a little bit because they'll notice that more than they will with the needle. And again, the other thing that I'll do sometimes is I'll actually, again, kind of agitate my finger a little bit on the skin, and they're not even going to recognize the difference between that and the actual injection.